Welcome, everyone. Welcome to the Head and Neck Cancer Survivorship webinar series developed by the Head and Neck Cancer Alliance and the American Head and Neck Society. Our session today is Caregiver Needs. I'm Dorothy Gold, an oncology social work clinical specialist at the Milton J. Dance Head and Neck Center at GBMC in Baltimore, Maryland. I want to thank Head and Neck Cancer Mason, as well as Dr. Marie Tobin for presenting on this webinar today. We're going to get started. First, I want to give a few directions. We will be accepting questions, and we will have a question and answer period at the end of this session. You can write your questions during the speakers, either in the chat or the question and answer. The chat, everybody will see it. Question and answer will be more private. And then later, when we start the Q&A, we'll also take some raised hands and specific questions from some of you participants. So our first speaker today is going to be Allison Breininger. Allison has been caring for her husband, Sean, since his diagnosis of Fanconi anemia 10 years ago. While by his side through a bone marrow transplant and multiple cancers, including tongue, throat, and bladder cancers, she came to realize that caregivers are often in the negative space, unseen, unrecognized, unsupported, yet a vital part of the big picture. Allison created the negative space where she writes openly and honestly about the realities of caregiving, encourages other caregivers to speak their truth, and provides concrete support suggestions for those with caregivers in their lives. So Allison,
Thank you very much. Thanks for having me today. So as she said, I'm Allison Breininger, and I'm the caregiver for my husband, Sean. He was diagnosed with Fanconi anemia 10 years ago in his 30s, and it's a rare genetic disease, and it causes a bone marrow failure and also cancer, especially in the head and neck, at a rate of up to 700 times that of the rest of us. In the years since his diagnosis 10 years ago, my husband, Sean, has had a bone marrow transplant. He had tongue cancer where they removed half of his tongue. He had throat cancer that was inoperable and needed 35 days of radiation and chemo. He has had cancer of the gums, cheek, lips, and over 150 skin cancers. He is screened by a team of specialists regularly. And with this disease, we know that more cancer is inevitable. As his wife and his caregiver through it all, I came to notice that my fellow caregivers were what I call, they were in the negative space. They were a huge part of the picture, but nobody saw them. They were very often not recognized, and they were highly unsupported, undersupported. I also noticed that caregivers tend to sugarcoat the experience that they have. They rarely speak about how challenging this really is, feeling like they can't because they aren't the one who's sick. And so seeing all that inspired me to start writing and advocating for caregivers at my site, The Negative Space, and partnering with different organizations to help them build caregiver support into their mission and their vision. I started a podcast with a fellow young spousal caregiver, and I created gift boxes that supporters can send to caregivers to help them feel seen and to feel loved. So being open and honest about being a caregiver is one of the things that's actually really helped me get through this in the last 10 years. Talking and writing about it is cathartic for me, but it's also helped the people in my life to really have a clear picture of what I'm going through, which has better positioned them to be helpful to me, both emotionally and logistically. One of the most concrete things that's been helpful for me in this time is a tool called IanaCare, which stands for I Am Not Alone. And it's an app that was created by caregivers, and it's designed for caregivers. And so with that, I've been able to create a team of supporters. And so I can do things like ask for help with groceries or the lawn mowing or meal prep, that kind of thing. But I can also, we've been in lots of situations where we've been like at the clinic and the appointment's going long and our daughter needs to be picked up from from school. And so I can use the app to reach out to my team of supporters and help in that way. So it's one of the most caregiver friendly and helpful things that I've been able to use that's helped me in these last 10 years. So I'll just end by saying that caregiving is really hard, that it's okay to say that out loud, caregivers. There's no way around the truth of how challenging this role really is. And that two of the things that have helped me get through, one is just speaking my truth so that I can both get it off my chest and so that others know how to help me. And because I know that I'm rarely going to delegate those caregiving tasks, I'm going to be the one to be there at my husband's side when he has appointments and procedures. But something I've learned over the years is that if I can help give off some of the other things that I do in my day, that provides me with more time to be with my husband, to be with my family, and to be the caregiver and wife that I want to be.
Thank you so much, Allison, for sharing your personal story. I know it means a lot to our audience to hear that. Our next speaker is another caregiver ambassador, Kristi Mason. As a mom, a wife, marketing communications professional, Kristi also became a caregiver in 2016 when her husband Andy was diagnosed with HPV-attributed head and neck cancer. Since then, Kristi has been working with the Head and Neck Cancer Alliance as a caregiver ambassador to bring awareness to this type of cancer, advocating for prevention, early detection, and the important role of the caregiver in the cancer treatment team. Thank you, Kristi, and let's hear. You're on.
Thank you, Dorothy. Can you all hear me okay? Excellent. Okay, well, it's a pleasure to be here. And Allison, thank you for sharing your story. It is hard to open up. And that's one of the reasons why I started here at the Head and Neck Cancer Alliance as an ambassador in 2016. And it was the same year that my husband was diagnosed with his cancer. And as Dorothy said, I did this for a couple of reasons. One was I really wanted to bring awareness for this type of cancer, and I'll talk about that in a little bit. Advocate for prevention. This is a cancer that can be eradicated through vaccination, and also early detection, in particular with dental exams. I also felt it was really important, as Allison talked about, to be a voice for the important role that the caregiver is in the cancer treatment team. I never felt part of the team, and the role of that caregiver is so important, and I'll tell you why. But first, a little bit about that journey that we started. It was 2016, and my husband felt and saw a very visible lump in his throat, in particular in his tonsil, that led him to really advocate for himself to get in with a specialist. And this specialist the appointments were few and far between, but he did get in there, and immediately he was ushered into surgery. And at that point, we knew we were in for a different kind of road. So upon learning the diagnosis, we met with the medical team who ultimately would put my husband through hell to make him well. And those are their words, not mine. This is exactly what his treatment team said to me. And it was at that first meeting with my husband's radiologist, who was laying out the details of the treatment plan, that I really stepped into my role as caregiver. And how I did that was, as the details were unfolding about this treatment plan, which was going to be 30 days of radiation and 8 rounds of chemotherapy. As he was laying out the details of this, I saw my husband just mentally hit a wall. And that is when I started to regularly take lots of notes, and it's so many notes. And as I reread my notes now, I look back on it and I doubled down on a lot of this. And so then I came home, started a binder, and started looking what a lot of people do. You hit Google, and I started looking online. And it was during that meeting with the doctor, his radiologist, that his doctor said to us that this type of cancer is at an epidemic level. In our little community, he was seeing 1 to 2 new patients every week with this cancer, new patients. And it really got me thinking about the scale of this cancer. But what I was reading online was very frustrating. The information was old, wasn't new, and the information for caregivers was just as frustrating as learning about the cancer, because it was all about palliative care. And that was not, I did not want to read about palliative care. I wanted to read about somebody who had walked even one step in my shoe to know that I wasn't alone. But it wasn't out there, and it was disheartening. So as my husband's treatment progressed, so did my caregiver role. And if there's caregivers out there, you will go through this progression. Each progression will be different. My progression started as a note taker, then I became the driver. Sometimes we were visiting the treatment facility up to 4 times a week. I became a nutritionist, often worried about what my husband was eating, very concerned about proteins, very concerned about fat. I watched my fat intake because I watched him over the course of 4 months drop 80 pounds. I also became a pharmacist, managing a lot of drugs, and there's a lot of take this, don't take this, if this, and then that. So you become a non-certified pharmacist, if you will, really managing pain. I became his voice when talking became too painful, and this happened. I became his advocate at times when, you know, the nutritionist, the certified nutritionist, would pay us a visit a couple times a week, and I could see it in his face that this was becoming more frustrating for him. Or when we made the decision to not do the last round of chemotherapy because he just couldn't, his body could not go through anymore. Had to become a cheerleader, and part of the cheerleader was encouraging him in those last couple of weeks of treatment to get past that finish line. And those last few weeks are a very tough hurdle. And through it all, it was a very isolating journey. As the patient, it is all about the patient, as it should be. But the caregiver, as I said earlier, is a very important part of the caregiving of the Get Well team. And I often felt pushed aside, insignificant. And this is one of the reasons why I have become an advocate for caregivers, because you are not insignificant. While you may not have the PhD or MD next to your name, you are doing all those things that I listed plus more for your care, for your person. And I want everyone to feel that has to walk a mile in these shoes or one step, that you're not alone, because I don't want anyone to ever feel the way I had to feel in this process. So that's my 5 minutes, which probably went over.
It's okay. Thank you so much, Kristi, and thank you too for sharing a very personal story with the people here. I think everybody really appreciates hearing directly from the caregiver, so I thank you. Our next speaker, we're going to move a little bit to the professional now. Our next speaker is Dr. Marie Tobin. She is board certified in general psychiatry, consult liaison psychiatry, and hospice and palliative medicine. She specializes in psychiatry of the medically ill, with a special focus on patients with cancer. She provides inpatient and outpatient psychiatric services at the University of Chicago Medical Campus. And she's going to talk about caregiver resilience and give her perspective. So thank you. Dr. Tobin, you're on now.
Hello and welcome everybody to this webinar. I'm very honored to be here and particularly humbled to share this platform with Allison and Kristi and Dorothy, and what an incredible account of caregiver resilience. I feel I could stop talking now, and you've seen it in action. But I will share some thoughts with you. I have had the privilege of working at the University of Chicago, which has for about 15 years now, and it does have a large caregiver, a large head and neck program. Next slide, please. Oops. Oh, I'm doing that part. Okay, so what do we mean by resilience? In this case, I am talking about psychological resilience. Of course, there's such a thing as physical resilience. And one definition is that it is the ability to resist illness, adapt positively, and return to a pre-morbid level of functioning in the face of ongoing stress. And my goodness, you've heard a lot about ongoing stress. There are many factors that impact resilience. Some of those are physical factors, some are psychological, some are social, and indeed spiritual. And I think particularly in the past year with the pandemic, we've heard a lot about resilience. And so just to share a few thoughts about it, it is useful to think of this concept as an ability rather than necessarily a personality trait. It is certainly related to personality traits and many other things. But for today's purposes, I may just share with you a few thoughts about coping styles and how that impacts resilience. We do know that resilience tends to be a little lower in women. It increases with age and significantly impacted by psychosocial variables such as loneliness. And we heard about Allison's wonderful app, and that's an example of bolstering resilience by reaching out to your community. This talk doesn't allow for me to elaborate necessarily on the relationship between resilience and mental health, but there certainly is one. And can resilience be enhanced? Absolutely. We'll talk a little bit about that. So coping styles vary. As I mentioned, it is both related to personality traits, but also to the actual situation in which the person finds themselves. And the skills or the things you reach for out of your coping toolbox can vary greatly over the course of a stressful situation. I think either one of our ambassadors can probably tell you that in the beginning of their journey, they were very much about problem solving, and then a point may come though where the work that needs to be done is a more emotional adapting to the particular situation. And that tends to be more useful in situations where the outcome cannot be changed. Now, a very important point I do want to make is that there is a relationship between coping and the meaning of the stressor to the person. As an example, if you have a loved one or a patient, in my case, who experiences their cancer as a punishment, that's not a good, doesn't portend good psychological functioning. And there can be many reasons for that. I did something bad in my past or whatever, but that's something we would have to address and flesh out and try to help the person think differently about it. There are, in terms of coping, there are what we consider less adaptive coping and more adaptive coping. So things like, I think we've heard a lot about resourcefulness and optimism and practicality and mastery. Our two ambassadors are examples of that, composure and balance. I am sure, though, at points they probably said, I did experience helplessness or pessimism or whatever, poor focus. And it's not that these are good and bad, it's that some are more adaptive and helpful than others. We do have emotional responses to stress, anger, anxiety, fright, guilt. But then happiness, hope, happiness around making progress towards a goal, or hope where you fear the worst, but you hope for the or yearn for better. And I rarely met a patient who didn't say that their diagnosis, or for that matter, a caregiver who said that their experience hadn't in some way resulted in a reordering of priorities and an intimate understanding of the important things in life. Now, without delving too much into this, as we already mentioned, there are some adaptive behaviors, seeking support, altruism, and I already mentioned reordering of life's priorities. On the other side of that, and we've seen this actually in alarming proportions in the pandemic, are the emergence of less adaptive behaviors like alcohol use disorder, intimate partner violence, and so on. So not to sort of focus on these too much, but we do need to have an awareness that these things can happen, and it can become overwhelmingly burdensome for the caregiver of somebody who has a protracted medical course, and it can be easy to slip into some of these behaviors. So one helpful concept is to think about stress, though, as and there's an adapting continuum. This actually comes from the adjustment to cancer. This is from the NCNN or the NCI, I think. So, the stress exists on a continuum that ranges from a normal response to something that may become a full-blown psychiatric disorder like anxiety or depression. And don't forget that being a caregiver does not necessarily protect you against developing your own medical problems. And sometimes those get put on the back burner. So I just put this in to highlight that a caregiver can also develop a medical problem, and that needs to be borne in mind. Pivoting somewhat now to talking about what are wellness promoting steps, I try to focus on the evidence-based treatments. And again, they divide into biological or physical, and sleep, exercise, or what we call in the field behavioral activation, diet, and sometimes medication is needed. Now, there is empirical evidence that reduced hours slept has a very broad impact on health. Exercise has been shown to be associated with better response to a stressor, sort of that concept of resilience, of bouncing back. And before you run off in alarm saying one more speaker telling us exercise, 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 the study I'm quoting, the people did an hour of exercise a week. I think we can all do that. One very exciting area, I think, is the relationship between diet and resilience. And this is all about the microbiome. And then, of course, sometimes psychotropic medication is necessary to address anxiety or depression. I'm not going to train you how to be therapists in this talk, but I do want to highlight two types of therapy that I think can be very useful if that's indicated for the caregiver or indeed for the patient. And those are cognitive behavioral therapy and mindfulness-based stress reduction. I do want to mention the importance of social support for caregivers, for the patient. There's so much evidence for its impact on resilience, but also for the patient's experience of the whole cancer journey that I won't go into it, but there's even biologic evidence of the ways in which social isolation can be damaging, physically even. And, you know, we've just come through a period of time where social isolation was the treatment of choice. So that's a concern. My last two slides are so cognitive behavioral therapy, very practical type of therapy based on the idea that so when we're stressed, our cognitions or thoughts tend to be very negative. That impacts our moods, which in turn impacts our behavior and some of those coping strategies, and that somebody can learn to monitor those thoughts and restructure them. And this in turn can result in changes in behavior. And I mentioned exercise or behavioral activation, and that in turn can improve physical feelings. And so here you go, you have a sort of an upward spiral. And then my last slide is about a very important type of therapy called mindfulness-based stress reduction. And that taps into our attentional control. So we spend a lot of time on automatic pilot, and if we can train ourselves, which can be done, to bring our focus into the present moment, it's quite remarkable the effect that it can have on the body. But more important of all, it is our brains are plastic, or we do have neuroplasticity, and the brain can be rewired out of those stress circuits to being not automatically getting on those stress circuits. So just to finish up, I've included some resources here for you. And I will just finish by saying we have an embarrassment of riches, I think, in terms of what's available out there on YouTube and in other resources. And I will stop talking there and hand it over to my colleagues. Thank you.
And thank you, Dr. Tobin, for giving us a theoretical framework after hearing the personal stories. So in addition to being a moderator today, I am also a presenter, and I am the final presenter. And my topic is basically an overview of caregiver needs. And my principle here, which I know many of you will feel, is that cancer is a family affair, and that caregivers feel it too. And in fact, everybody in the family feels it. Can I get the next slide? Is it?
Oh.
Okay. So I have to say that I have been working as an oncology social worker with head and neck cancer patients and their families and loved ones for going on 18 years, only in the area of head and neck cancer. So I would say that it's a good experience with that group of people. And I have heard many of the stories like we heard from Allison and Kristi, and I've worked with many caregivers. But I thought, even though I have all this experience, I think I'll go and look at the literature and see what's out there about caregivers. And there was some, but each article that I found started or ended with, there is not enough being written about caregivers, or there needs to be more attention and research on caregivers and the impact of the illness on caregivers. I know many of you out there can relate to that. So I thought, well, where do we get the information about caregiver needs? We get it from professionals and their anecdotal stories. I can say that I have many of these from my work that I can share and that I've gotten an impression. We get it from caregiver stories, just like those we heard today from our ambassadors. And then we get it from research, some that's out there, which of course, most of it is caregiver and patient surveys. So So I'm going to start a little bit and talk about the patient and what they're going through, just kind of an overview. What we know is that it's a great physical symptom and a symptom burden for the patient. We know that treatment for head and neck cancers can result in a number of physical and functional problems for the patient, that there's functional deficits that include increased pain, problems with eating, swallowing, dry mouth, trismus, and speech impairment. They may have to deal with visible manifestation of facial changes. The symptom burden can be great, and they may also need to use a feeding tube for nutrition, have a tracheostomy for breathing, or a laryngectomy for new voicing. So there's a lot of changes physically that often have to be dealt with. For some reason. Next slide. Okay. Then there is that psychological burden, some of which Dr. Tobin spoke about. First of all, there's that shock of a cancer diagnosis that goes with any cancer. And I know I've heard many patients say when they first found out or caregivers, it was really like, oh my God, I can't believe this is me. Many of these people come to us with pre-existing stresses and mental health issues, and now are being added to this new cancer. So there's a fear of unknown, decreased quality of life, financial and or job-related concerns, resulting fewer social interactions, and heightened anxiety and depression. And we know from research on depression that cancer patients as a whole have a greater incidence of depression than the general population, but that among the cancers that have the highest levels of depression, head and neck cancer is one of them. So that's something that really needs to have attention. So what does it mean for the caregiver? Well, everything that I just mentioned in those last two slides, the caregiver feels too. They feel every single element that the patient feels, and they feel that plus what their own stresses and burden. So what happens when they become a caregiver? Suddenly they have to manage appointment schedules. They have to navigate the healthcare system and the medical bills. They have to become an advocate for the patient, managing their own emotions while dealing with the patient's emotions. So there's always that feeling like, I don't want to cry in front of the patient. I have to be strong so they'll be strong. But yet they're feeling it too. And they don't give themselves permission to feel it. They have to manage the family, whatever's going on in the home. If it's young children or for some have a aging parent that's with them, all those other things have to be taken care of. They have to manage the finances when the patient isn't able to. And often we see role reversals. We do see more often the woman being the caregiver. So in that case, they're suddenly taking up some of the things that we know the husband might be doing. But it could be the reverse, because we do have women that are the patients who maybe did more of the household things, and now suddenly the husband is having to do that. And then there's keeping families and friends up to date. Everybody wants to know what's going on. How do you do that when your time is so limited? And then, of course, finding time for self-care. And that is really important. I think that Dr. Tobin addressed that it is important to take care of oneself. I often have to say to the caregivers when they say, I can't, I don't have time, that if something happens to you, then there's going to be nobody to take care of your loved one, and there'll be no one to take care of both of you, or someone will have that burden. What else does it mean for the caregiver? There is physical elements to this also. Oh, next slide. So they have to suddenly, I think that it was Kristi that talked about all the things that she had to do in terms of the medications and becoming a pharmacist and becoming a dietitian and learning all of these things. Well, you also often have to learn how to take care of a feeding tube and provide feedings. For some people, there's airway management, and they have to learn how to take care of a tracheostomy. Or if there's a laryngectomy, there's learning how to suction, how to clean the stoma. Sometimes there's wound care after a big surgery, or there could be wound care. Suddenly the caregiver is learning how to pack a wound and change it, or from radiation, they get, their skin could get very red and they have to learn how to do skin care. So suddenly they're like a nurse, or they feel like a nurse or a doctor even. They also have to support the nutrition and hydration. So not just giving for those that aren't on a feeding tube, there's constant worry. Are they eating enough? Are they drinking enough? And that actually can cause a stress in the family. Managing the medications, which again, Kristi did speak about, especially the pain medication. Is it too much? Is it not enough? Are they going to become addicted? Should I limit it? But they're in pain. Nobody's addressing the pain. And so they become a liaison to the healthcare team. Now, what determines the extent of caregiver burden? So first of all, the point of relationship. And some of these points, of course, I did get from the articles that I read, but some that we know, and that I'm sure both Kristi and Allison can agree to, that the stress is greater when the caregiver is a spouse or partner. We also know that the point of the treatment affects the degree of stress, so that the time period from diagnosis through start of treatment can be very stressful. And also during active treatment, as the treatment progresses and the side effects worsen, as the symptom management becomes more difficult, the quality of life and the psychological health diminishes, then the caregiver burden becomes greater. As you get farther along away from the treatment into survivorship, some of that will diminish. And then the extent of the care needs. So we know that as those care needs increase, like if somebody does need wound care, if somebody needs some of these greater care, feeding tube, suctioning, then we see that the distress for the caregivers increases. And it has been found in some of the research that caregiver stress, emotional stress, seems to be greater when they need to use a feeding tube and when there's a low energy level of the patients. So it's really hard for them to see this change in their loved one. So what are the caregiver needs? I talked about what happens, and a lot of what I've said, many of you out there who are caregivers or patients probably say, oh yes, we know that. Certainly Kristi and Allison told their stories, and they were very similar to some of the things that I've brought up. So what do we need to do for caregivers? Well, first of all, we do need recognition that caregivers have psychosocial and emotional needs that are unique to them and that require attention. We know that caregivers can have greater stress than people in the general population. And we know, as Dr. Tobin said, they ignore some of their problems and they don't address them. So the people around them the healthcare team needs to recognize the needs of the caregiver and make sure that they are addressed. Caregivers also need information about the disease, the treatment, and the anticipated side effects and the anticipated timeline of recovery. I know that I believe it was one of our caregiver ambassadors talked about that, trying to know what to expect. But it is really important to give them that information right in the beginning to make them part of that team. I think that's what the comment was, so that they feel that they know what to expect, and that will reduce anxiety. And then education on the care and support related to symptom management. So for instance, when somebody has to use a feeding tube, we want to make sure that the patient knows how to do it or the caregiver knows how to do it. We obviously want to encourage the patient to do it themselves, but we know that many of them want to defer to someone else, or we need the backup of someone else. But they're only going to feel comfortable with it if they're taught how to do it, and if they're made to feel comfortable, if they get practice. And so that's really important. The same thing with the wound care or with suctioning when there's a tracheostomy, the education of the care and support for the symptom management. So if constipation is a problem, they need to know what do they need to do, not be home trying to figure it out themselves. So education is really important. And then validation of the emotional response and the psychological needs. I know that I spend time with caregivers, and sometimes all I do is say, I know it's hard for you. I don't have to say more. And they feel that, and that really can help. And then some do need counseling or therapy, which again, Dr. Tobin did address. Sometimes they need the emotional support of one-on-one, and sometimes a support group can really help, or having a mentor. So I know that I facilitate a support group of head and neck cancer patients and caregivers that come together, and that very often one caregiver will give support to another caregiver, and it is just wonderful to see that, and it is so good for we call them the newbies, and the uh, seasoned survivor or caregiver. They really that support, and sometimes just having a mentor. So we often hear about one-on-one patient mentors where you match up a patient to another patient that's been through the same experience. But it can be very helpful to sometimes, if you have a caregiver that is going through a difficult time, getting them to be able to talk to another caregiver. Just one-on-one really does make a difference. And coming to the support group, one of the things I've learned over the years is we always thought of our support group as for people once they're done with their treatment. It was a survivors group. But we found that having patients or caregivers come right at the beginning or before the start of treatment help them get some of that information and some of that support early, and that helped them cope and adjust as they went through the experience. Um, and then social support. Everybody has talked about the importance of social support, but caregivers don't always make use of the social support that's there. Sometimes they feel that they need to be the one that's doing the caregiving, or they don't want to burden someone. It was wonderful to hear Allison talk about that app, which I had not heard of, and I'm going to now start sharing. But there have been many online programs where people can get help, and I would try to encourage where you could put in if you needed food or something else. But that app sounds wonderful. But the caregiver has to be open to support, and many times they don't want to. And I found a saying that I often use, and I think it is wonderful, and that is the act of receiving is giving. So that when you receive support from someone, when you receive help from someone, you're actually giving them something because you're giving them the opportunity to do good. And people always come up and say, just let me know if I can do something. But they don't really know what that is. And that's not always helpful. So if you can say, yes, I can use somebody to bring my husband to treatment on Monday and Wednesdays. That gives them a good feeling, actually. It's not necessarily a burden. So I love that saying that receiving is the act of giving. And then using some things like that app that Allison spoke about. And the last thing I'm going to mention is caregivers making a difference, how that can help them. And we heard that both from Allison and Kristi, what they've done. They've become ambassadors in the Head and Neck Cancer Alliance program, and what they have done and how that's helped them. But it doesn't have to be something big. Many caregivers will say, well, I'm not the type of person to do something that bold, or I don't have the time for that. And that's okay. Sometimes just reaching out yourself to one other caregiver, you're making a difference. Sometimes just helping someone, or going to a support group and sharing your experience with other people, that too can make a difference. So everything is relative. It doesn't have to be big, but you can find something that makes you feel like you're making a difference. And I know that, I don't know if many of you know, but November is considered, they say Family Caregiver Month. I always say it's National Caregiver Month because family is, it can be more than just family. Not everybody has family. Sometimes people's support system can be friends, can be neighbors, can be their animals, their dogs. Have often we've heard people, but it's important uh, to to make a difference in that way. And in our group, every November, we highlight and we honor our caregivers. And one time I remember this one wife of a patient said, you know, she never thought of the caregiver. So we all know people always say, how's whoever the patient is? How are they doing? What do they need? Nobody says anything, how are you the caregiver? And when she became a caregiver, she realized that she could use things too. So now her husband was in survivorship. The first thing she does when she meets someone or even has friends that are going through an illness is she reaches out to the caregiver. So it can be just reaching out to a friend or neighbor. But again, doing something to make yourself feel good. And all these things that I mentioned, obviously not everywhere are they available. Not every place gives you the education that you need or the information that you need. Um, so sometimes it is important to speak up and to make your needs known. And I think that that's important. But I guess can we go to the next slide? I realize. So as you can see, my little picture there is a light at the end of the tunnel. We know that patients with head and neck cancer survive unique challenges specific to functional problems. We know that the functional problems can increase the psychological stress, and those functional symptoms and the care needs can contribute to psychological distress for the caregivers. So we need a focus of support that includes support to caregivers. And I feel that that's increasing. Just this webinar here is an example of recognizing the needs of caregivers. So kudos to the Head and Neck Cancer Alliance for making this available to people. And we know that helping the caregivers ultimately helps the patients and helps the healthcare providers because it leads to a greater adjustment and a greater compliance. And then the last thing, to bring it back to the beginning, to all those articles I read, we know that we need to focus on this more and we need to study it more. So with that recap, I'm bringing the whole topic, the presentation topic of this webinar to an end. And I thank all of the presenters, and we're going to turn it over now to the question and answer period. And I'm going to just go over some specifics again. So from the chat, we're going to take some questions or the Q&A that you will find at the bottom of your Zoom. And also we are going to allow for raising your hand. And for those who aren't aware, if you click on the participant at the bottom, then there you should see something that says raise your hand. And if you raise your hand, then we'll try to reach out and take your questions. So, okay, here's one question to start, and it looks like either Allison and or Kristi will be the ones to answer this. What was the hardest part of caregiving and how did you manage it? Who wants to take that one first? Just raise your hand and unmute.
I'm happy to go first.
Okay.
It's hard to narrow it down because there are a lot of hard pieces, but I think that one is that we have a 14-year-old daughter. And so she was in preschool when my husband was diagnosed. And so I think it's the piece of always feeling torn of how do you support both his needs and her needs. If I'm at the hospital with him, I feel guilty that I'm not at home with her, and vice versa. And so over the years, just trying to find ways to involve her, not in a way that makes her, I don't want her to feel like a caregiver necessarily, but I have found simple ways that were sort of age appropriate as she went through. Like, we have pictures of him during bone marrow transplant where she was helping him put on his little sketchy socks at the hospital, right? And so what are just little ways that she can be involved so that I can sort of be with both of them together, and then also to reach out to the support system to, like, how can I, knowing that I can't be in both places at one time, how can I call on our team to be with her when I'm with him, and vice versa. But I think even now that she's older, I still feel that pull of needing to try to meet both of their needs at the same time.
Thank you so
Yeah,
much. Kristi,
I
did you
can,
want to add something?
yeah, I can jump in here too. I think, you know, the hardest part for me was actually answering the, what can I do? Because for me, that was a sign of weakness. And I had two kids, two young kids. I had a job that it was a new job for me, and I actually had international travel. And it did get to the point where I wasn't balancing, and I wasn't balancing it all well. And so it didn't come naturally. It was awkward, but I would say to my neighbor, can you help me cut my grass? Um, um, I would call a neighbor and say, hey, I hate to ask you this, but can you please drive my husband to and from the hospital? You know, just things like that. And it was the hardest part for me, for my personality. But, you know, I like, Dorothy, what you had said is it's just, when they ask that question, they want to be part of it. They don't know how. So when you give them that direction, it is helpful for them. And it's so obviously so helpful for you too.
So very true. And I'm glad that you brought that up, because I feel that is one of the hardest things for caregivers often, is to ask for help and to accept help and to know that it's okay. And as you said, it's not a weakness, it's actually a strength, is how I see it. So thank you. It seems like the questions we have here, and that seems appropriate, are mostly directed towards you, the caregiver ambassadors, because people want to know about your personal experience, which is very understandable from my experience. So here we go. Um, how did being a caretaker impact your relationship when the caretaking role eased or ended? Who wants to, or
Well,
did
I
it
can,
change? I guess you can say that.
yeah, it seems, let me start, and also you can jump in. I think you're in a perpetual caregiving role. I think for me, um, it kind of has ebbs and flows. But I'm always worried. You know, you're always worried at that 1 year mark, when you go in for when you go in for the follow-ups. So you take that burden of worry. You take the burden of worry when COVID hit. How is this going to affect the immune system? And then, you know, we're at a 5 year mark now, but we're starting to see some of the side effects of treatment. And so now you're starting to think about, okay, what has this done for blood pressure, for potential heart disease, for all these things that the treatment does cause. So I don't know if you ever really give up that caregiver. You kind of slip back into it when you have these peaks and valleys.
Agreed. And yeah,
That's very, go ahead.
yeah, I was just going to say, Kristi, you said it well, that I'm in a perpetual sort of state, because my husband has had so many things, and we just know that with his disease that more cancer is coming down the road. But we certainly have more intense time periods and sort of less intense. And so actually, as I mentioned earlier, that I co-host a podcast about caregiving for spouses, and the episode that just came out today is about marriage. And one of the things that my co-host and I talked about is that sometimes it's tricky for us we have to sort of figure out how to take off our caregiver hat and put on our spouse hat, because we sometimes can see our spouse as like, are their meds, do they look feverish, and forget to just be there, or have to really sort of help ourselves shift into being there as the spouse, as the friend, because we sometimes see ourselves as caregivers first and foremost, and then that, you know, that can be a little bit of a rub. So yeah, we were just talking about that on the podcast.
So I'll just add to that a question, because the person is asking, how did that change? What about from your husband's point of view? Like, what is their response to the periods where they maybe don't feel they need the caregiving as much? Are you able to change that? Or is that too tough of a something to think about anyway? All right, I won't force you to answer that, but it is something that goes, I think that the person asking the question, because you want to think, in your case, Allison, your husband, you know, it is ongoing. I hope, Kristi, that in your case, possibly your husband is getting farther away from the treatment and in successful survivorship, and that you're able to give up that role or lessen it, ease it up somewhat.
I am, yes.
Yes. Okay, so let's see. We have another question here. Allison, what types of items are in your caregiver package?
Yeah, thanks for asking. So the theme of the box is like, it's called I'm Part of the Story, because I think that's a big part for caregivers, is that they don't think about sort of like what is the impact that it's having on them, and that all the things that Dr. Tobin talked about are impacting them, and that because they're living through all of those hard things as well. And so the box says I'm part of the story. It has a big coffee mug that says I'm part of the story on it. It has a travel size thing of relaxing tea that they can, you know, if you're in the hospital, if you're in the clinic, you can just like have it in your pocket or in your purse. It has a travel sized notebook for all those notes. Like Kristi said, she's at the appointment and she's taking all of those things. It has a pair of socks that says I have a story on them. It has a poem that I wrote called Take Care of Yourself, because we're often told, like, are you taking care of yourself? Are you taking care of yourself? And that can feel like a really hard thing to be told. Oh, and then a meal bar, because we know that often when we're in hospitals and clinics, the cafeteria is closed and we feed them, but we don't feed us. And so a meal bar is in there as well. And so I'll put the website in the chat, but you know, people can support in that way. But also I have had dozens of people sponsor boxes, so that when I meet caregivers, like Tony, I'd actually like to connect with you, because when I meet caregivers, I just like to be able to send them a box for free. So a number of people have sponsored them so that I'm able to do that. So they're for purchase, but also I have them sponsored as well. So thanks for asking.
So the boxes are available for purchase from the website.
Correct.
Okay.
But if the cost is prohibitive, I have sponsored boxes that I'm able to
Okay,
get.
well, that's good to know. Thank you. Okay, so here's another question. This time I think that I'll throw it first at Dr. Tobin, and you know, we'll see, I could add to it also, but how can you help the patient emotionally while maintaining boundaries for your own mental health?
Oh, that's a very, very good question, and terribly important, actually. So I think, you know, I think Dorothy said presence and validation are very important. And I think it's a beautiful segue from what we've been talking about. How do you transition from that caretaker role to something else? Because even within a 24-hour period, you know, I think there's a phrase in a book called Spaces in Your Togetherness. And I think, you know, I can't emphasize enough the importance of, as a caregiver, getting a little bit of time apart. If your patient is in the infusion suite, well, then it's okay to go and take a walk where your runners to the treatment. You know, the definition of treatment is hurry up and wait. And Kristi or Allison, I think I'd add a book to your box. I'm always encouraging patients, please bring something to read, because you'll become veteran waiters, and so I think, you know, using those opportunities to take some time for yourself, You know, I think ultimately everybody does better if you set some boundaries and take care of some of your needs. Of course, you've got to acknowledge them first. And there can be very little room for that, but I think it's very important to do.
I just want to add one other point. So the patient and the caregiver are often protecting each other, and they're not telling each other how they're feeling, which makes it all more difficult. And sometimes it's okay to take a time and to share your emotions with each other, because I think that helps both. And it helps the mental health of both. Maybe it'll help the boundaries. And so I do try to encourage people to really talk to each other. And if you need to, cry together, because, you know, if you've got somebody that's crying in another room because they're afraid to cry in front of, they may both be crying in another room. So it's really okay to do that. So that's just another point. Okay, well, it looks like we're about at 6 o'clock when we're supposed to end here. So I want to thank again all of the survivors and the caregivers that joined us today and took their time to come listen to the information and the stories. And I hope that you were able to gain something from this. I know that even participating and listening to everyone and listening to the questions, I was able to learn something more. And a special thanks to our panelists, Dr. Marie Tobin and the Head and Neck Cancer Alliance Ambassador Caregivers, Allison Breininger and Kristi Mason, as well as we want to thank the Head and Neck Cancer Alliance and the American Head and Neck Society for their time in organizing and hosting the webinar. And I think I said it when I was speaking, and I'll say it again, the fact that they recognize this as a topic for one of their webinars is so very important, and it's one step towards giving caregivers the recognition that they need in their needs. So thank you again, everyone, and have a good evening.
Thank you, everybody.
Yes, and this is available, will be available as a recording in about a week if anybody wants to share it with other people or tell others about it. So thank you again.
Thank you. Bye-bye.
Bye.